Thank you, Dr. Oettmeier, for joining us. It's a great honor to have you with us in Ljubljana this year at the MAHA Symposium from the 29th of May to the 30th at Ljubljana Castle. And we do look forward to your lecture very, very much. And this is why we've asked you to share just a few sneak peeks of what will be coming in May. So most physicians actually associate Procaine still with anesthetics, so local anesthesia. What changes when you use it for systemic health?
Yes, thank you at first, dear Elisabeth, and thank you to Sebastian. I appreciate very much the invitation, and I'm happy to come. And coming back to your question, most of the physicians, they know Procaine as an old, meanwhile not so long-acting local anesthetic, but for us, it's a permanent, not only old one, it's also a very innovative substance, and we call it also, according to the famous Romanian professor Aslan, as the royal remedy, because we have on one hand side the local anesthetic effect, but it's not so long, but we have minimum 20 different more effects which we can expect when we administer Procaine. And there are always possible, especially the injections, the infusion. We can do it locally, we can do it for the segmental treatment, and this I like very much. And here we have also a 100-year tradition. Meanwhile, we can use it also IV and as infusion. And Procaine, for example, is making a vasodilation, so we can also expect that increases blood lymphatic flow to bring away irritating substances. For example, we have an anti-inflammatory, anti-rheumatic effect. Procaine is also preventive for cancer. It's also acting in the core of the cells, and we have many, many other features. And it's a big gap for colleagues, for doctors, when they do not use this wonderful remedy.
I see. Dr. Berko, when you hear about remedies such as this that influence the nervous system, they regulate the overall body systemic health, how do you decide where to implement this with your patients and what matters most before you decide when you use it?
Well, I must say that the therapy was introduced to me by our common colleague, Dr. Thomas Rau. I am I am still waiting for the German Society of Neurotherapy to make the proper educations in English language. I'm waiting still. They said that they will do it. But since I read Dr. Ottmeier's, Ralf, your article that you published, we are using Procaine more often. I use it in every oral surgical procedure as neural therapy on the sites where I remove teeth or any other inflammations. And sometimes I do also neural therapy as I was taught. And it is important to measure HRV, if Ralf, you will confirm. And based on that, well, more or less, I think we could apply it to every patient. Every patient that comes needs detoxification. And if we only think of lymph drainage, as Ralf said, it is a very useful remedy. And I must tell you, I have some very fantastic cases of patients that, for example, felt like a bit something in the chest, and then you do the neural therapy on this standard acupuncture points, and all of a sudden they give you a message after 1 hour that this feeling went completely away. So for me, I'm really not an expert. I would like to be. So Ralf, if you will maybe do some courses in your clinic in the future, I would like to come to teach directly from you to gain even better insight into the therapy. But I follow the article that you publish on the concentrations for IV Procaine, and it works miraculously, I would say, although it's scientifically proven.
Dr. Oettmeier, you sometimes describe the effects of this therapy as like a reset. How does that present itself clinically, and how would a patient experience such a reset?
You have totally right. Also, this is a very important feature of Procaine. It's influencing the nervous system, the balance and the periphery of the sympathetic and parasympathetic, and how my friend Sebastian mentioned, it's a very good thing when there are imbalanced things in the blood flow and also in the regulation. It's very good to use it locally segmental. But the true reset, yeah, we know the word from the restart of a computer, we can reach when we especially use more and also with uh, increasing dosages Procaine IV. And we know from research, there was made a lot meanwhile that Procaine is also influencing the limbic system and also in the frontal part of the brain. There are some areas which are clear influenced by Procaine. That's why it's acting also antidepressive. It makes a little bit more happy. It's a little bit similar like the happy hormone serotonin. And in this direction, we like very much also this, I would like to say, positive side effect. And some people, they say the next day, sorry, now I feel again happiness. A long time it was not so easy to find out in my system, but now obviously it's coming back.
Dr. Berko, sometimes when we use therapies that are regulative, like this one, the patient will experience a shift in several symptoms at once. If this does happen, is this immediately a positive sign, or is there such a thing as too much at once?
Somehow, I think that with experience, well, I think it can be. Me being originally a dentist, I got asked frequently that what should we do first? Should we do the surgeries in the mouth, or should we do first the detox and upbuilding, so to say? And through these years doing also integrative medicine, I learned that. Um, well, maybe I just remembered one case which was very interesting, and you will decide then if it's too much or not. I got this patient that came because she couldn't see properly on one eye, she couldn't work with computer, and her life depended on it. That was her career. She went to some very good Ayurvedic doctors here in Slovenia, not at our clinic, and she came to extract one tooth, the endodontically treated with inflammation even. And we did the extraction. And with the extraction, I said to her, maybe we should do some detox and upbuilding IVs, ozone treatment, and such. And when we applied detoxification infusion, which also, for example, contains, which in the protocol there is also procaine, she went home and she, I think, called at midnight at our emergency line, and she was throwing up. She was on the toilet the whole night. She didn't know what to do. And in the morning, she came to the clinic, and I talked to her, and I look at her, and she's completely overwhelmed with the situation. She didn't go for the emergency. Uh, and I tell her, and I see that her color of the skin is back. She's no longer this, grayish tone and, without energy when you look at the person. And I ask her, and how do you feel? And she's like, oh my God, I feel the best in 10 years. So what did we do? The Ayurvedic doctors mobilized the toxins with the oils, with the fantastic therapies that they have, but she was missing the appropriate cofactors to drain this out of the body. And obviously, I was very lucky. I just wanted, just to do some minor, mild detoxification, but the gate opened and everything flew out of her body in one night. And I went, my friend is a composer, and I went for her exhibition in Cankarjev Dom here in Slovenia. And I ran into this patient just before I went into the hall, and she said that she is at the moment, and it's a true story. If she will see this post, she can confirm if she wants. Of course, I can't give the identity. That on the ophthalmological department, they're actually even seeing in the eye something renewing, which is very unusual. So this is my take on the regulation. Patient sometimes think that everything will be like in the spa, but you know the body reacts differently. So we need to well, Ralf is obviously much more experienced than I am, but sometimes this is the way it is. So it's not always possible to really dose the right amount. I think in the end, what we want is to feel like we were 30 again, at least in terms of concentration and energy.
Dr. Oettmeier, when you if the people who come to see your lecture at the MAHA Symposium and they become inspired by your lecture and they've never done neural therapy before, but they feel like they need to include this in their system, in their clinics, really practically, how would you go about doing this? Do you take a course? Do you need to first, is this like a craft? Is this something that you have to actually learn how to do as a craft, or is the theory enough?
Oh, I think a very good idea would be, like Sebastian mentioned, that we perhaps organize as soon as possible also seminars and for the beginners and also for advanced colleagues to learn all important techniques. And it's not necessary to know everything about also complicated techniques. It's the most important thing is that you start, that you take a syringe, that you put in Procaine, that you have appropriate needles. At first, you can start with the smallest, with the shortest, which is available, and then you start to treat, for example, scars. Also, in this direction, I recommend very often in my seminars. This is a true story. I made my first neural therapeutic training. Meanwhile, 38 years ago. Yes, it was before the
Wow.
19th. The wall between West and East was still standing. And the first thing which I recommend to try it with your mother-in-law. Yeah. Also, when you love your mother-in-law, it's independent from the emotions. And she suffered since years after an operation of her gallbladder from the so-called post-cholecystectomy syndrome. Yeah. It
Mhm.
means that you have pain after eating or also between. And then there was a bigger scar. Meanwhile, they are smaller, but she had a bigger one. And then I told her, hell, hey, mother, I have a method, and you are very brave, I know. And I made the injection of the scar, yeah, very superficial. This is totally harmless. And then, yeah, after minutes, she told me, "Oh, wow, there's a warming up in the abdominal area. I feel so light. It's a little bit like a tingling around." And since this time, the pain was away. Yeah, the syndrome was deleted. And with such things, then you are more enthusiastic, and then you start to do more. And the next rule is, it's a famous city in Switzerland, Davos, and according German language, we say da wo es weh tut. It means that you make little injections in the area in which you feel the pain. Also, I'm sure Sebastian had started in this direction in the area of
Mhm.
the mouth and also outside and around, and how you told with this example of the chest. And then step by step, you make superficial little injections, intracutaneous, subcutaneous. And when there is more muscle between, you can use a longer needle and you put in the muscle tender point. And step by step, you will reach a higher level. And you would like to do as much as possible this neurotherapeutic injections. And parallel, there are also colleagues like me, I belong to the group, they like very much infusions. Infusions, they go directly in the system. We go around the other organs, and you can start with a small, I say, mini dosage of procaine, for example, 50 milligram, maximum 100, and you start to make a short infusion IV. And during my speech, I will also explain more the details and also approved combinations. But it's important to stay on this wonderful concept and to start to check, to prove, and perhaps starting with the mother-in-law.
It's a wonderful tip. Dr. Berko, you have a lot of different therapies in your clinic. Is there any therapy that you would not combine this with? Is there any contraindication to be aware of?
No, in my experience, no. It's something that we do on the, so I do it as I learned. I didn't, Ralf, if you will make a course, I'm already enrolling officially now. So I learned from Thomas Rau the kidney points, the McBurney point, and since I do oral surgery, I'm handy with needles, and I can somehow, estimate the depth and everything. And we do it for basically every patient. So I'm really not sure. Maybe Ralf should answer this question with more experience. But I never thought of it as something that couldn't be done.
Yeah, I totally agree. You can do it for all. Yeah, the most important contraindication is perhaps the doctor and the therapist self. Yeah, when he has
Mhm.
not a good estimation of the situation. And important is also to use a very good kind of Procaine from the quality without any preservatives. This makes also at the end then absolute no risk. And yes, we are doing it also in psychiatric cases when necessary. There's no contraindication, but with a smaller doses, you begin carefully step by step.
Mhm.
Thank you, build. Dr. Oettmeier, one last question. What would you like your audience in May to start thinking about now before you give them your full lecture?
Yeah, I think I have perhaps a little bit demonstrated in this interview. Important is to love the method, to have a good knowledge about the background, the content, the features. I am one of the biggest fans of the world regarding Procaine, as you know. And to close the scope, how I have started in the beginning with the words of Professor Aslan, to hold Procaine in the hand is to hold a royal remedy in the hand, and it's a wonderful thing to use it. Yeah, as much as possible every day with different kinds of also uses. And in this direction, I can only say yes to Procaine.
Thank you very much. It seems like you live this therapy and you celebrate it, which is wonderful. And we're very grateful that you will be coming to Ljubljana to speak to our participants of the MAHA Symposium in May 29th to 30th at Ljubljana Castle. Thank you very much.
Thank you also. All the best and also a big also luck for the organization around.